healthcare has an enormous number of challenges today. There are financial changes going on, costs are going up, there's an information overload. Nobody can keep up, not the world's best physician can keep up on everything. And as our medical records start getting automated, we're going to inevitably be discovering mistakes in records that nobody ever really looked at before. And we can all want things to be better, and someday they will, but for people who need to do something now, the best thing you can do to help your own cause is to be involved and doing everything in your personal power to help things go well. Well, one thing you can do is look at your medical records. You have a legal right to get a copy of your medical records. Different states and different hospitals and doctors have different policies for how much it may cost you to do that, but you can look into that. It will help you to start to understand your conditions. Another thing you can do if you haven't done it yet is start looking for some online patient communities. For instance, if you're diabetic, you can Google diabetic patient community. If you have congestive heart failure, you can Google something with that in it, and just start to become familiar with what information is available online. You might not find a complete, perfect, instant fix, but it's a start. You don't have to do everything perfectly on the first try. Like with anything else, you just start and learn as you go. There's a learning process that we all have to go through, and that includes patients as well as physicians. As we start to change the cultural expectation, a lot of people gained their expertise in an era where no useful information came from anywhere other than the medical establishment. And good information still does come from there, but a lot of information now can come from other places as well. So people who resist, there's a small number of clinicians who are just obnoxious and pushy. If you have that kind, then you may want to shop around for other doctors. But more often what I find is that it's clinicians who don't realize yet that it is possible for somebody to find useful information. So you can respectfully, treat the person as a partner. You're talking about the care relationship. So as with any other relationship, if there's something that's not going well and you'd like it to be different, you can say, I wouldn't say to a doctor, honey, but there's something I'd like to talk about. I'd like to be able to do something like this. Could we talk about it? If the answer is no, we can't talk about it, then you may want to think about moving on. Well, there's a lot going on in 2012 that is going to really change the landscape. For one thing, the TEDx talk that Hugo Campos did about his implanted cardiac defibrillator data is getting a lot of attention, and I think it's going to attract a lot of attention from software innovators. There is a health IT exchange thing developed last year called the Direct Project that will make it much easier for us to get copies of our data. And in general, more and more people are starting to hear about the idea of patients being active. Our Google search results that we track show that there are like 3 times as many web references to e-patients in 2011 as there were the year before. Ladies and gentlemen, get your E on.